Hi, my name is Dr. Ray Benedetto. Chances are, if you're on this website right now, either yourself or a loved one suffers from some kind of chronic, debilitating lower back problem. Maybe it's sciatica, maybe it's a herniated disc. You've had some kind of chronic back problem for a long time and just haven't had any answers. Well, I'm here to tell you, number one, you're not alone. There's a lot of people out there that have lots of chronic back issues, whether it be with the nerves or the joints or the discs. Some estimates are that really about 80% of people in their lifetime are going to have some type of lower back pain episode. So you're not alone. What I am here to talk to you about today is a relatively new treatment that we're using. We've been using it here in our office now for over 3 years. It's called spinal decompression. The device that we use to do the spinal decompression is actually right here behind me. It's called the DRX 9000. What it is it's a newer non-surgical way that we can now treat things like herniated discs in your lower back or bulging discs, degenerative discs, different types of spinal stenosis, which a lot of patients are being diagnosed with as they age, different types of sciatica, where the nerves in your back may be being pinched and it's giving you all types of leg pain or weakness or numbness and tingling, those type of things. And a lot of patients who end up in our office, they've had these things for a long time. They've been through the therapy, the physical therapy, they've been through the epidural shots in the lower back, they've had chiropractic care, you name it, they've done it. Over-the-counter medications, pain medications, some even have had surgery by the time they get to our office. What we do, what the spinal decompression does, and how it works is, first of all, you need to have some type of what we call a compressive injury in your spine. So you need to have any of those conditions I just mentioned for this treatment even to be indicated. And what the spinal decompression treatment does over a series of visits is to help relieve the pressure on any damaged discs or nerves non-surgically. It's really nice because up until this technology was available, we didn't have any other alternatives. It was either live with it or get surgery, and even for patients who weren't surgical candidates, that wasn't a good option. So what happens with spinal decompression is it's a nice non-surgical way that we can treat these things. So what's happening is the spine is being compressed by one of those conditions. What the machine does over a series of sessions is to help take that pressure off of those areas, to help give pain relief, relieve pinched nerves, those kind of things. Like I said, what you see here, this is the actual machine that we use here in our office. It's called the DRX 9000. It's pretty sophisticated technology. It's relatively new to the scene. Everything is computerized. We can actually individualize your treatment for whichever level in the spine your problem is. We can actually target whichever disc level the problem is. There's nothing scary about it. It's over here to my left. There's actually a nice comfortable bed where you can lay down and you lay on your back, and we hook you up to the machine. And what it does gradually over time, like I said, is help to relieve some of the pressure on some of those damaged areas. Our success rate, is very good for the right type of candidate, which is also a good question. Now, who is a good candidate for this type of treatment? What types of conditions does this treat? I alluded to some of them earlier. Different types of disc problems, bulging discs, herniated discs, degenerative discs. Different types of spinal stenosis, not all types of spinal stenosis, but different types of spinal stenosis. And also sciatica, which is pretty common too, where you can get a pinched nerve in your back that gives you pain or numbness or tingling or things down into the leg. It's been working really well for us in our office. Even cases of patients who may have even had surgery. Maybe the surgery failed. We like to get them before that point so we can do this to help save them from there. But we even see patients who have already had surgery. The treatment has been very successful. It's got a nice proven track record now. It's been available over the last 10 to 15 years. Very safe, very effective. Is it right for you? That we don't know unless you were to come in and have us check you out. But if you have one of those conditions and it's not to the point where it's too far gone, it's too bad off that it can't be helped, then there may be hope. There may be a chance that this particular treatment would be right for you if you haven't tried it already. So if you would like some more information, what you can see on the page here, over to my left on your right hand side, there's an area of the website where you can fill in your information. Your name, address, and we'll send you some information to give you all the nuances and all the details as exactly what would qualify you as a patient for this treatment, and what exactly this treatment does, and kind of some of the details and the history behind it. So if you've been suffering for a long time, if you've been through everything under the sun and nothing has helped, this might be a good option for you. So if you'd like some more information, you can contact us with the information on this website, or leave your information over here to my left, and we'll get you that information as soon as possible.